using right now for your telehealth solution? Well, if they give them a kind of a funny puzzled look, we don't have one, and then boom, you're golden. If they don't have a telehealth solution in place right now in 2016, you need to jump on that. That is a huge opportunity for you to get your foot in the door. From there, what he kind of does with me is, gets them excited, sends them some materials, maybe a few follow-up calls. After that, what they're going to do is they're going to set an appointment with the broker support team. And that's what I do over here. We jump on webinars. 99% of the time, the webinars work flawlessly. 1%, you might have an issue with the PowerPoint. But after that, I'll get into the admins and the CFO about our product, our offering. Not only are you going to get this amazing smartphone app, but you also have a client portal. You have a partner member portal as well. All these tools are used to engage that employee to ultimately get them to use a telehealth consultation for the first time. And Pat and everybody out there, as you know, if you use telehealth one time, you're going to get, it's that first time use syndrome. You're like, wow, I literally went to the urgent care on the weekend, when all I had to do was pick up a phone and call HealthiestYou. So that's kind of how he's positioning it to get in there. And if they are using a telehealth product, a lot of times what they'll do is they'll say, hey, guess what? We are using a telehealth product. And then they'll be like, oh, that's great. Good for you. You're progressive. You're with the times. Do you mind if I ask you, what was your last month's utilization report like? And then a lot of times they'll give them a puzzled look from there. Well, we really don't know what our last month's utilization were. And that's when he kind of jumps in and says, hey, how do you know if your employees are using this? You need to be engaged. This is the only way you're going to change behavior, is to have those conversations and to know where you stand with your company. So that's a huge part there. After you get that, set the meeting with our team. The first 5 deals or so that you're going to close with HealthiestYou, we are going to be extremely involved in the process of walking them through a fully functional PowerPoint deck, of showing them, hey, start with HealthiestYou first. There's no consultation fee. There's no travel time. Let's keep your employees in work, keeping them more productive, and skip out on all those germs and all those other co-pays. Or, if you're on an HSA, you're paying a lot of that out of pocket. So that is a kind of the door opener. Pat, do you kind of want to add anything to that, to the door opening portion?
Yeah, I can add a few things. Just so you know, Brad, we are seeing a PowerPoint on the screen, right? So I don't know if you know. Okay, I just want to make sure you knew that. I think from a prospecting standpoint, I hear this oftentimes from many of our distribution partners that, HealthiestYou, people want to talk about it. Customers want to hear about it. Customers, frankly, I've been in this business for over 30 years, and I always find it fascinating that not a lot has changed in those 30 years. And so for a lot of employers, and I'm sure you all feel this often, that it's kind of talking about the same thing. It's kind of the same products. Bringing HealthiestYou to the customer is a very different sort of product, very different technology, very high level of innovation. And what I hear from a lot of our broker partners is it's just a phenomenal door opener. It's a way to get customers to want to talk to you. So I would really, really encourage you to consider leading with HealthiestYou, especially for a new prospect. Obviously, for your existing prospects, we'd love to have you go in and sell us to all of them. That's ultimately what we'd like to see happen. But for new prospects, try HealthiestYou as a door opener. See if it works. That's the feedback we get. Is it's just a tremendous way to get your foot in the door, to get the conversation going, and to talk about something that's different, that can actually have a meaningful impact on lowering their medical expenses.
Yeah, that's exactly what I was thinking too. And you kind of touched on it as well as, adding it to your already existing book of business. I think it's a great way to retain prospects as well. That was another touch point I wanted to talk about today, is that, you guys have a difficult position out there of presenting increases in premiums. I mean, I have never done that, so I couldn't imagine, but I got to imagine that's a difficult conversation to have. It doesn't matter if you're on a fully insured product, a level funded, a self-insured, any of those products presenting a increase, it's got to be difficult. So what we've actually had, and I was on a call earlier today with a large trust, and they've been presenting premium increases, and this year it was large. They got hit pretty hard, and they finally have kind of come to the conclusion that, hey, we need to do something about this. We need to retain this large client, and what they're doing is they're presenting HealthiestYou, and we've had a ton of webinars and going through the ins and outs, but they're really seeing this as a solution to their issue to rising costs. So yes, they're going to have to pay for HealthiestYou. You know, it's not free. You know, we do have a team that is really engaging, and you know, it takes money. So they're going to pay for HealthiestYou. Our plan is to redirect a ton of those claims, you know, those urgent cares, those ERs, those primary cares, and get them to filter through the HealthiestYou doctor network instead of going to that more expensive cost point. So they're kind of picking up on it. They understand, you know, changing behavior is not easy. They've had a wellness product in place, and, you know, incentivizing the employees, incentivizing the employers to implement this wellness program, and they're not seeing any results. Their claims are still through the roof. So what we're saying is, that, you know what, let us do your dirty work. Let us go in there, let us engage the employees, teach them, hey, this is expensive. You need to use HealthiestYou instead of going to that expensive point, and really driving down the medical costs. And the conversation, the dialogue's been great, but that broker that took us to them, he was scared to bring them a 20-25% increase in premium, but now he brought it to him, but said, you know what, I'm your consultant. I have a solution for you. Let's give this a shot. I feel like that is a great way to retain prospects. You can also keep people like, you know, the brokers we're training to go out and get new business. You'll at least be educating your clients of the products that are out there. Now, whether or not they take it, I mean, that's up to you, but at least you're doing your job of keeping them informed and being a consultant. Tad, do you have anything to touch on as far as retaining prospects, and how do you position HealthiestYou?
Well, I think, you know, I think you're right on. Retention is huge. I mean, that's where, you know, we all, ultimately all of our businesses on the phone, you know, each of our businesses depend on keeping the customers we have. That's where we have our highest margins. And having HealthiestYou in there, demonstrating to them the claim savings, you know, we tend to hear very often that the employees, you know, really we saw a slide that came across here on surveys. The satisfaction is extremely high. I hear it all the time that HealthiestYou becomes perhaps the highlight of the benefit offering, and that's only going to lead to higher retention for, you know, you as a broker with that customer, because you put in a product that the people you know, the people really value. And, you know, Brett mentioned a little bit about pricing, and I think, you know, I'd like to just talk about that for a moment too, because, you know, our PPM, it may be higher than perhaps another company's PPM, but what I think I'd really encourage you to look at is effective cost. What does it really cost the customer? Because at the end of the day, if somebody's PPM is much lower and nobody uses it, you know, that's very expensive than a higher PPM where there's a lot of utilization. So just stay with me as we kind of think through this. So you have a higher PPM, lots of utilization, you're ultimately lowering the bigger cost, which is the medical expense. And that is what we have to really focus on, is driving down those medical expenses, because at the end of the day, if we're able to do that and drive those medical expenses down a lot more than the cost of our PPM, the employer is going to realize a positive ROI. We hear it over and over and over again, where we might replace another company whose PPM was a fourth of ours, but nobody was using their product. And, you know, at the end of the day, if nobody uses something, doesn't matter how cheap it is, it's too expensive, right? And that's really, I think, a fundamental premise that we built our business on, let's not get hung up on, somebody's PPM's lower. That's not where the real money is. I mean, the PPM, if you're writing a 2 to 99 life group with us and it's a $9 PPM, it's $108 a year for an employee for an all-you-can-eat buffet. They can call the doctor as many times as they want, and we will actually give them the education and the visibility and the engagement into our product that they'll actually use it, right? And if we can do that, we will show a much more positive ROI when we're driving a 40% utilization than perhaps a competitor, instead of a $9 PPM, is below a $5 PPM that nobody uses. So I would just really encourage you to really think about those claim savings and how that ties back to an ROI. And we've got great tools in our broker portal, and we've got salespeople like Brett if you ever need an ROI. And we've got great reporting. So we can actually show the customer that utilization, which I hear over and over again is difficult to get in the market from perhaps some of our competitors. And so take advantage of the tools that we've created for you, the ROI tool, the utilization reports. And that's what our sales team is there to do, is to help you if you need those kinds of resources. So don't be shy. Be asking for help on that. That's what we're here to do. Brett?
Yeah, exactly. That's what I do all day. We show people how to use the partner portal, how to use the tools in there, how to access sales flyers. Basically whatever you need in order to become successful helps us become successful, and that's our main goal here. And we talked about utilization, as you can see on the screen. The embedded features that a lot of the carriers are coming out with, low utilization. 1 to 5%. Nobody's using it. You're never going to change behavior when you're working with 1 to 5% utilization. And that's why we come in. We're all about changing behavior of, going to that ER first, or just pick up a phone, call HealthiestYou directly. And then of course you're seeing the big number here, the 58% groups that have been with HealthiestYou for at least 1 year. You're seeing them catch on and they're using it, and then word spreading around the office, and they're realizing that it is so easy to use. Not only does that the broker support team and you guys out there in the field really help us drive that utilization by doing the education out there, but the flip side is that probably the most important part of our company and what we do over here is our client success team. And what they have created is what you're seeing right now, the engagement pulse. That engagement pulse is a very turnkey rollout for your new group. So every new group is going to be assigned a client success representative. What they're going to do is make sure that group's successful. They're going to do the introductions. They're going to get you marketing. They're going to follow up with utilization reports, show you how to use all the tools from an admin level to promote telehealth, promote HealthiestYou, get the app on the phone, and ultimately drive utilization. Nobody else is doing that, and that's why we really, really are successful. We work together as a team. If maybe a group isn't seeing the utilization that they need, client success walk over to sales side. Hey, can you contact this broker? Maybe there's been some changes within the company that we don't know about. Can you find out? We need to attack this from a different angle and get the group using HealthiestYou, because that's what we know. We need that utilization for us to become as successful as we want to be. This is just an example of the email marketing. We do all types of marketing, retargeting ads. So when you're on Google, you're going to see HealthiestYou pop up. Now I'm going to get into a little bit of our success stories, if you will. We always talk about, the return on investment, the high utilization rates. Well, as you guys know, rates, premiums, everything's increasing. Our teachers are not getting paid enough. They used to have very rich benefit plans, and this has kind of declined over the years. And so what this school district has done is they decided to, we're going to tackle this. We're going to be proactive. What we're going to do is add HealthiestYou. We're going to pay for it for all of our employees. They're not going to have a consultation fee. It's going to be completely free. And what we're going to do is we're going to promote it. We're going to get our employees to change their behavior. They've worked with us, and they saw an 86% utilization rate. Instead of seeing that 10 to 20% renewal premium increase, they actually saw a 2% reduction, which is huge. That's unheard of right now in the industry. And what they did, they took that money, instead of just putting it back, into the executives' pockets, what they did was they spread it out. They gave it to the teachers and the staff in the school district. We have a lot of success stories like that out there. We talked about the admin client portal. What you're seeing on the screen is the monthly utilization reporting. So this is an example of what you're going to see from an admin standpoint to see if people are using it. You know, you're looking here 128%. Let's say this is 4%. Well, you know, contact your client success, get the sales team involved. What we're going to do is figure out a plan to get them using it. Because ultimately what we know is the higher the utilization, the lower the healthcare cost, because we're changing that behavior. And it looks like we're about 40 minutes or so into this. I'm going to do a quick app demo just to show you guys what our features look like. Pat, if you want to say anything while I get this fired up, feel free to jump in.
Yeah, I was on mute. Sorry, Brent.
No, it's okay.
Yeah, absolutely. I mean, we keep kind of emphasizing this, and that is the day-to-day execution. It's it's not if it was easy to drive utilization, everyone would do it. It's not, and it takes a lot of different things to happen for that utilization to occur. So it's not just one thing. We talked about the client success engagement. We talked about your critical efforts as a broker out in front of the group promoting HealthiestYou. We talked about our technology. And so I just want to, underscore that it's lots of little things that are going on. And it may be a different activity that happens to impact each group, but that's okay. What we're trying to do is come at the groups from every angle to drive that awareness, to drive that utilization, to drive down medical costs. And that's really, what we're really trying to, go through with you today. So, Brett, it looks like you've got the app up. I'll shoot it back to you.
All right, great. Yeah, as everybody sees here, once you sign up a new group, everybody's going to have access to the HealthiestYou app. It's a very simple enrollment process. What you're going to do is download it from the Google Store, the Apple Store, HealthiestYou, one word. And then the registration process is simple. Last name, date of birth, zip code, register your app. And this is what you're going to see when you first log in. So this is our main screen. It's the today. And we're always going to remind you, visit a doctor. That's kind of the devious vision of the app, is that we're going to give you all these cool features. And maybe they'll bring you back, and maybe you'll come back for, recipes or check your deductible. But ultimately, what we want you to remember is that you can visit a doctor. And that's how we change that behavior, and that's how we redirect claims. So we're going to put that right off the front. As I scroll down, you're going to have our wellness content. You're going to have a quote of the day. And of course, you're going to get a video from our Chief Medical Officer, Dr. Kelly Traver. Today's video is going to be on controlling asthma. So those change daily. Take a look at those. Those help bring people back to the app. We're going to switch over to Radar. This is going to be a very Uber-like feel. It's going to give you the care points in your area. We know if you're looking for a doctor, you jump on the app and you click this doctor right here. You're going to find the details about Thomas. We're always going to remind you to call the doctor directly to make sure they do accept your insurance. As you know, doctors can add and drop what carriers they decide to take. So you're going to have a better doctor rated doctor. You're going to find the rankings, the bio, and of course, what we're going to do, we know you're looking for a doctor. We're going to remind you right here, click this button, visit a doctor 24/7. That's the whole goal of this app, is to really remind people that you do have HealthiestYou. Let's redirect that claim. Let's save money for not only the employee, but also the employer and the plan. So that's the Radar. You're going to find your primary care, your pharmacies, your urgent care, your hospitals, and of course, we got to take care of the whole family. We're going to have vets in the area as well. That's the Radar function. We'll switch over here to the app button in the middle. This is going to be our offering, and kind of the cool part about our app, and what, I don't know if a lot of you people out there know this, but all of our features that you see right now, they can kind of be turned off, turned on, and we can also add features. So we're always looking to build the most engaging smartphone out there. So as new technology comes out, fitness devices are huge. We're going to be releasing our app with syncing up to your Garmin's, your Fitbit. So we're always putting more products in here that's going to drive people back to the app. Simply click a button, request a consult, you're good to go. Top providers, I showed you that on the last screen on the Uber-like Radar screen. You can also price prescriptions. very similar to what you do when you jump on Amazon. You know, type the name of what you're looking for. What we're going to do is it's going to shop the 5 or 7 pharmacy benefit managers in your area, and we're going to give you the lowest cash price possible. So the goal really is to get you to use this, shop the prescriptions, become a better educated consumer, and hopefully we can beat your pharmacy copay. Or if you're on a high deductible plan, you know, we're going to save you that out of cash expense right out of pocket. Keep going on this. We'll see. Check insurance. This is a big tool that a lot of our admins like. People find this fascinating to know that you just have the snapshot of your deductible at the palm of your hand. So this is me. We're on All Savers. I haven't used anything towards my deductible this year, but maybe I want to find if my insurance is active. Maybe I want to find what my copays are and my limits are as well. We have all those features that sync right up to your plan. So another tool, and what we always talk about, bring you back to the app. Maybe your recipes, maybe you're a vegan, maybe you're doing a South Beach diet, something like that. You can jump on here and you can find a recipe for a tasty dish. So after that, you're going to be able to save all those to your circles. You know, just one more thing to kind of bring you back to the app. One-stop shopping, save your RX, save your providers, and save your recipes. If you would like a more in-depth kind of behind-the-scenes tutorial on the app, feel free to reach out to your broker support. They'd love to walk you through that and show you kind of the features and how they perform. One more thing I want to touch on about the app before we keep it going is that what we do, and part of our whole philosophy, and you've heard me say this a lot of times today, is to re-engage a member and get them to remember they have HealthiestYou. So when you download that app, what we have done is we have geo-fenced your high-cost forms of care, such as urgent care. You step into an urgent care after you downloaded your app, you're going to get a push button notification when you walk in, because we have geo-fenced with Google. Your reminder pops up. Hey, Brett, did you know it appears you're in an urgent care? We want to let you know that you have HealthiestYou. Would you like to contact a doctor right now? Maybe you're already there and you're not going to do it, but a lot of our calls now are coming from this feature because they're like, oh yeah, that's right. I did download this during my open enrollment meeting. Let me connect now. Let me save myself that $125 or $100 or you know, maybe you're in a more expensive urgent care. So that's another feature. We do that same thing with pharmacies. So you go into a pharmacy, you're going to get a push button notification that says, you know, let's check the prices. Maybe you can beat your copay. You know, if your copay is $25 and we have the prescription for $5, you know, I might as well keep that extra $20 in my pocket rather than give it to the big pharmacy companies out there. Keep moving forward. The industry is booming. We did, what was it? I don't have the exact figures in front of me right now, but we're projecting as nearly as 300 million e-visits within a few years. So this is coming out. This is everywhere. It's and you're jumping on now at a kind of an early adoption phase. You might as well work with HealthiestYou. We will kind of be your partner through this new telehealth phase. So Pat, are you still there?
Oh yeah.
All right. Angel was mentioning that the audio cut out. I'm looking out there in the field there. Jesse, do you see the audio? Are we good?
Yeah, no, I heard everything you said, Brett. I assume everyone else did.
Yeah, they're looking at me like it cut out. So what I'll do is just kind of wrap it up with you, Pat. If anybody is on it out there, you know, thank you for tuning in. I apologize for the technical difficulties. We will email you. And what we're going to do is announce the winner of the iWatch. You know, I really wanted to get into a few more of these touch points, such as, you know, talking points for off-season follow-up. I have a lot of guys, you know, using HealthiestYou as a touch point to re-engage the groups. You know, adding HealthiestYou to the benefit plan going to help with those dwindling commissions that are out there. A lot of people are struggling with the cut in the commissions. We can always get into that. Contact our broker support. What they'll do is they'll help walk you through how to present that and give you another revenue stream. And then, of course, the ease of doing business. Implementation time really only takes a couple of days. You know, we would like you to submit groups and give us about 30 days so we can get that proactive outreach and have that best rollout possible. But like I said, ease of doing business. It really could only take a couple days if you get a group thrown at you and they want a fast, effective date. But other than that, I think we'll kind of wrap it up, Pat. Looks like we're offline. I'll give you a call here in a few. And thanks everybody who tuned in today. I really appreciate it.